Hello everyone, this is M. Wade Tufte and I'm going to take you back to the basics. This is the first lesson. I'm going to teach you about how to study, what the test is about, what to think about while you're taking the test. And this is all in preparation so that you're only going to take this test once. I'm going to show you how to study the right way. Use your amazing mind and memory. Understand what the NCLEX tests. It's very specific. Fully evaluate each question, know how to answer each question, and frame each question with the ABCs, Maslow's hierarchy of needs, the nursing process, and patient safety. The right way to study the best way to learn something is to do it physically. So you may not have ridden a bike in 30 years, but you can get on a bike and ride a bike. The reason is that you did it repeatedly, maybe as a child, and you have that muscle memory. You know how to do it. You know that you know how to do it. So you get on and you ride. The second is to connect it to something in your brain that will help you remember. It's always easiest to remember somebody's name when it's the same as yours. It's real easy. You can remember that person because it's connected to you, or someone that is named after your brother or your sister. You have to connect it to something in your brain that will help you remember, something that is familiar to you. Now, everyone has their own learning style, although the best style is to use all the learning methods at the same time. Repetition is always an easy way to learn something. If you can and you have a difficult concept, write it on a piece of paper, put it on a post-it note, stick it on your mirror, look at it every time you go into the bathroom, put it on your notebook, put it in your car. You know that song you can't get out of your head? Even if you don't like it, you know it, you've memorized it, even though you didn't want to memorize it, because you've heard it so many times on the radio. So that's one of the techniques we're going to use throughout these modules. We're going to use repetition, and I'm going to go over concepts maybe in a little bit different way throughout the different sessions so that you can remember them easier. The next thing is study first thing in the morning and last thing before you go to sleep. Your brain remembers first and last. The first thing you do in the morning is going to stick in your head. So is the last thing you studied before you went to bed. So if you can, study in 45-minute intervals and then take a 15-minute break and do something that's totally relaxing. You'll have that every hour. You'll have a first and a last. You have what you started studying first part of that hour and what you have the last part of the hour. And then you've taken a break, and then you've got another first and another last every hour. If you study straight for 3 hours without taking a break, in that hour and a half mark in the middle of your studies, that's going to be your least productive time. You're going to remember the least amount of information. So break it up. You actually study a little bit less time, but you can remember more. People learn visual, auditory, tactile, but I'm saying the mix is the best way. Visual learners, if you know your learning style, use it to your advantage. Use visual aids such as diagrams, pictures, graphs, visual cues to help you put the content into perspective. And I will go over some of these in the middle of this session. It also is good to use colorful pictures, pens, so if you are studying something regarding respiratory, write everything down in blue ink. If you're studying something for neuro, write it all down in black ink. It's just that visual cue and the different colors will help you remember things. The reality is most people do use a mixture of styles, and majority of students would do better using all of the styles all of the time. Your brain anatomy and physiology. So your brain is successive layers built on top of each other, with the most primitive reactions stored in the lowest part of your brain, what I would call the lizard brain. And the cerebrum, the higher part of your brain, is where you are using all your higher functions, logic, abstract thinking. These are all things that you can only really access when you are relaxed and not under a lot of stress. When you're under a lot of stress, you kind of move down throughout the layers of your brain and you start using more reactionary parts. And so that's not when you can come up with your best ideas. You come up with your best ideas when you're sitting in the bathtub or you're sitting on the couch not doing anything you have this epiphany. It's because you are relaxed, you are not under stress, and that part of your brain is able to function best. I'm going to go over a better way to take notes. I know you're thinking, well, I've gone through school, I'm already done. Now's really not the time to trade up styles. But I'm going to tell you that it probably is. Because when you're using mind mapping, you're using pictures, lines, doodles to make more connections in your brain and connections to remember the material. The central idea of the lecture or the topic goes in the middle, and the lines off the middle are supporting points. So it looks like a neurocell. Pictures and doodles, they add to the number of ways your brain can remember. This is what your neurocells look like. This is what mind mapping looks like. So as you can see, it's quite similar with the central idea in the middle, and all the little arms are the other things that will help you remember. There's other memorization techniques which we'll go over in different parts of these sessions. The memory mansion, where you visualize in your head a house or a mansion, and every room is part of the concept that you're trying to remember. So when you go into the blue room, that is the respiratory room, and everything in that room relates to something you're trying to remember. This will help you associate it with more things in your brain versus just one word. It helps you utilize all your senses because you visualize yourself in there. And if you're using the memory mansion, it helps because you can repeatedly go to this house, go into the memory mansion, look at the different rooms, and remember the different things. You don't have to believe it. There's plenty of studies out there that show that it does work. Here's the frame, which I would encourage you to use with every single NCLEX question. So you are studying and you're looking at each question. If you print this out, cut out the blue area, and take this frame, put it over the question, it'll help you think about every time I'm answering a question, I'm thinking about the ABCs, thinking about patient safety, I'm thinking about the nursing process, and I'm thinking about Maslow's hierarchy of needs. So if you put all of that together with each question, it helps you frame what you're thinking about. And every single question you will have to use this for. You do need to set aside enough time to study. Remember, studying the right way and at the right time. If you're working a lot, this is not and when you're trying to study for this test, it's not the time to do overtime. It is the time to set aside enough time so that you can get all the repetition in that you need. And you need to relax because that's when you're using the most advanced part of your brain. So breaks are a must. The frame which I showed you, which we can go through, is all of the overriding concepts have to be applied to each question. Airway, breathing, circulation, Maslow's nursing process, textbook answer, and national patient safety goals. So let's think about this frame. ABCs, always protect the airway. If you're not breathing, you don't have an airway, you're not breathing. No other thing matters for that question. Support breathing and keep the circulation going. If any of the answers are related to that, those are the right answers. Those are the most basic primitive functions. You need to understand the Maslow's hierarchy and think about the patient's needs. They don't always go from the bottom to the top of that hierarchy, although most of the time they do. You always follow the nursing process. If one of the answers to the test question is assess or reassess, it's often the right question because assessing is a basic skill that is almost never wrong unless it's an emergency situation. The test is about thinking like a nurse. That's what it's trying to test, whether or not you can think like a nurse. And in that, they want you to remember patient safety. The national patient safety goals are all about things that have happened in real life that they're trying to avoid, and that's how they came up with those goals. So patient safety is always important. Always go back to the basics. Airway, breathing, circulation. Here's Maslow. You have the physiological. You have above that safety. Then you have social. Then you have esteem or respect. And at the very top, self-actualization. So physiological, that means breathing, eating, elimination. Those are some basic needs. Those things need to be addressed first, almost always. Safety. So you're talking about shelter, making sure that you're not going to be harmed. The bottom two are very basic functions. Social, love, belonging, friends, the need to feel connected, and esteem or respect or achievement is the second to the top. And at the top is self-actualization, where you become everything that you thought you should become. People start at the bottom and they work their way up. So as you're going through this test, you have to remember this pyramid. We're going to go into more detail. Physiological needs are the highest priority and must be met first. Of course, there are exceptions. The exceptions is sometimes people don't eat to address another higher level of the pyramid. They may skip meals so that they can achieve something. So they've neglected their physiological needs, but they can only do that for so long. Safety and security. Safety can be physical or mental. You can have a physical security, but you also need that mental security. Things that could threaten safety are illnesses, accidents, environmental threats. Psychological safety involves feeling secure and without undue anxiety. Social. People need to feel loved and accepted. People often go to great lengths to feel like they belong. Esteem. People want and need to feel respected. They need to feel like they have achieved something in their life. Self-actualization. The top of Maslow's hierarchy of needs is self-actualization. Self-actualization can only happen when all the lower levels are met. Let's talk about the nursing process. I'm sure you're familiar with it, but I want to talk about why it must be followed for each test question. Assessment, analysis, planning, implementation, evaluation. It goes in that order, and now it's circular, and so you can do it all over again after you've done it, but you can't skip steps. Here's a test question that will apply your knowledge of Maslow. A woman is admitted to the hospital with a penetrating stab wound. An open exploration intervention is scheduled. Which preoperative nursing intervention is most important for the nurse to consider in this patient's plan of care? So let's break this down. The key word is most important for the nurse to consider. So what it's saying is, remember the ABCs and remember Maslow. What we're looking for is something that addresses the physiological needs. So if she has a penetrating stab wound, of course you'd want to give fluid replacement. You would want to consider her pain relief. You'd want to consider emotional support because it's a very distressing time. And you'd want to consider respiratory therapy, but which one of these is more important? Penetrating stab wound, what you can guess is that fluid replacement, since it's involved circulation and the ABCs and the physiological part of Maslow, is the thing that is most important to consider. So if you thought about the frames, you put the frames over this question, that's how you're going to get your answer. Physical needs must be met first. The nurse obtains a diet history from a significantly underweight 15-year-old girl who is currently a long-distance runner at the school. The girl tells the nurse that her typical daily diet includes Pop-Tart for breakfast, pizza and soda for lunch, and cheeseburger and fries for dinner. Which of the following is the most accurate nursing diagnosis based on this data provided? So what we're thinking about is the most accurate. Highest priority need. Is it altered nutrition? More than body requirements? This is obviously the wrong answer, and some of these are just put in there as fillers. So we can rule that one out. Knowledge deficit related to nutrition. Well, that's true. Altered nutrition related to inadequate nutrition and increased demands of intense sports. That's also true. Risk for injury, fall injury related to poor diet and contact sports. Well, that one is also just a filler. It's obviously not correct. The two we're looking at is 2 or 3. knowledge deficit nutrition, that's true, but the most accurate I think is altered nutrition, related to inadequate nutrition and increased demands of intense sports. So that is the highest priority need for this kind of patient. Prioritizing care. The nurse plans care for a 16-year-old girl admitted with an eating disorder. On admission, the girl weighs 282 pounds and is 5'4" tall. Lab tests indicate severe uncontrolled diabetes, elevated BUN creatinine, and hypertension. The nurse should give which of the following nursing diagnosis the highest priority? Highest priority, we're looking at our ABCs. We're looking at Maslow. Body image disturbance related to obesity. Self-esteem disturbance related to feelings of inadequacy. Probably both of those are correct. Altered nutrition more than body requirements related to increased intake. Also correct. Decreased cardiac output related to inadequate fluid intake. So some of the things that you can take away from this is she has a elevated BUN creatinine, which often indicates dehydration. That's a measure of your kidney function. You have hypotension, which is a measure of your circulating blood volume. So what you're going to consider is the ABCs, the most basic needs are not being met. Circulation. Decreased cardiac output related to inadequate fluid intake. So that is our right answer. That's the ABCs. That's related to circulation. Now let's go over what the test is about. The minimum number of questions that you will need to answer is 75 and the maximum is 265. Each exam has 15 pilot questions which are not not added to your score. The candidate is asked a question. If they get it right, they're asked a harder question. If they get that question wrong, they're asked an easier question. So you answer a question correctly, and then they ask you a similar question. This is not the time to get nervous and think that you may have answered it wrong. You wouldn't know, because sometimes they'll ask you a similar question whether you got it wrong, whether you got it right. What you have to remember is that's the way the test is set up. And so if you see a similar question, don't assume that you got it wrong or you got it right. You just need to relax and continue to answer the questions. So the exam continues with items selected being administered in this way until a pass or fail decision is made. Until they figured out whether or not you can think like a nurse, in other words. There's 6 types of exam questions on the NCLEX. You got multiple choice, or there's really only one correct answer. Sometimes these are the easiest to answer because sometimes the clues to the answer are in the test question. Fill in the blank, hotspot where you select a specific area on a diagram, exhibit, information needed for the answer is in the form of an exhibit or a spreadsheet, ordered response, select choice in the proper sequence, or a multiple response. More than one answer is correct. Select all that apply. Sometimes those are the most difficult. Who writes the NCLEX-PN exam? Well, first, data is collected to reflect the current practice of the entry-level nurse, so not the experienced nurse, but the entry-level nurse. And this is changed as needed. This doesn't stay the way it is. It's not static. It's changed. Test question writers are selected from educators with current experience in the specific areas needed. So I was chosen to be an NCLEX-PN test exam writer. I had extensive experience in cardiac, intensive care, critical care. And those are the kinds of people that are looking for to write those kinds of questions. The NCLEX-PN detailed test plan is reviewed and approved by the National Council of State Boards of Nursing every 3 years. Expert resources support changes that reflect practice trends. And comprehensive listing of content for each client need category and subcategory. Memorizing or understanding, this is the question. For the most part, as you can see, as it goes up from knowledge to comprehension to application to analysis, analysis is the most important. Most of the questions will relate to that. You may have to memorize some things, so you may have to have some knowledge. You may have to have comprehension. You have to know how to apply it, but it's really the analysis is the higher level functions that it's testing. This is another way to look at it. Increasing difficulty and sophistication of test questions. Here's an application question. The nurse administers 15 units of regular insulin at 8 a.m. to a client with type 1 diabetes. The nurse monitors closely for a hypoglycemic reaction during what hours? So this is testing your ability to know your medications and to apply it to be able to figure out, based on what you know about diabetes and hypoglycemia, when a reaction might occur. If you are familiar with your insulins, you know that regular insulin peaks in about 2 hours. It has an onset in about 30 minutes, but it peaks in about 2 hours. So what we're looking for is a problem around 10 o'clock. So number 1 is the right answer. Sometime between 10 and 11 is when the person's going to have a difficult time. Here's an application question. These questions assume that you have a basic knowledge base, and they're testing your ability to put it into practice. You must be able to perform a nursing assessment, use critical thinking, and formulate appropriate intervention or response. Comprehension question. The patient arrives in the emergency department complaining of frequent urination, frequently feeling thirsty, and being constantly hungry. The nurse knows that these symptoms are commonly associated with dehydration, allergic reaction, hypoglycemia, or hyperglycemia. So it's testing your ability to know the disease that this is addressing and know what kind of symptom they may be having. In this case, you're assuming the patient is diabetic, polyphagia, polydipsia, and polyuria. You're thinking hyperglycemia, common symptom of diabetes. Client needs sample question. The nurse is delivering external cardiac compressions to a 63-year-old woman while performing cardiopulmonary resuscitation. It is most important for the nurse to maintain a position close to the client's side with the nurse's knees apart, maintain vertical pressure on the client's chest through the heel of the nurse's hand. We check the nurse's hand position every 10 chest compressions, or check for return of the client's pulse after every 8 breaths by the nurse. So if you know CPR, you'll know that the first part, it may be technically correct. The second answer, maintain a vertical pressure on the client's chest through the heel of the nurse's hand, well, that is correct. We check the nurse's hand position every 10 chest compressions. You don't check every 10, and you don't check the pulse after every 8 breaths, so you know that it's number 2. Sample recall and recognition knowledge-based questions. Which of the following is a serious complication that can occur after open reduction and external fixation of a femur fracture? So you're thinking about surgical interventions, you're thinking about orthopedics and long bone fractures. So things that you have to think about is some of these may be correct, but you're looking for the most correct answer. Is it deep vein thrombus, constipation, nausea and vomiting, or pain at the surgical site? So it could be all of those, but if you're looking at the keywords, which of the following is a serious complication, then you can only really consider deep vein thrombus. So even if you didn't know that was the answer, B, C, and D are not a serious complication. Let's examine each component in greater detail, including sample questions that will emphasize these key concepts. So throughout the sessions, we'll be addressing all of these issues. Let's look at clients' needs. So this is safe and effective care environment, subcategory management of care. There's 17 to 23% of the questions will refer to advanced directives, referrals, clients' rights and advocacy, collaboration, prioritization, confidentialities, consultation, continuum of care, delegation. Client needs, safe and effective care environment, management of care, 17 to 23%. Priorities, informed consent, ethical and legal issues, performance improvement, referrals, resource management, staff education, supervision. Client needs, sample question. The surgery department calls you and tells you to medicate, sedate, and bring your patient who is scheduled for a tubal ligation. She states she signed an informed consent but was never told about the risks of surgery. The nurse best serves as this client's advocate by performing which of the following actions? So best serves as client's advocate. Keywords. Writing a note on the front of the client's record so that the surgeon will see it when the client arrives in the operating room. Documenting the client's record that the client was not told about the risk of surgery. Contacting the surgeon and asking the surgeon to explain the surgical risk to the client, or reassuring the client that the risks are minimal and unlikely to occur. So let's break this down. Number 1, writing a note on the front of the client's record. You could do that, but the client is already sedated, or would already be sedated if you did what the order stated. Number 2, documenting the client's record that the client was not told about the risk of surgery. Well, that's also something that you could do. Wouldn't technically be wrong, although it doesn't address the issue and doesn't make you the client's advocate. Contacting the surgeon and asking the surgeon to explain the surgical risk to the client. This is the only one that really makes you the client's advocate, and so it's the right answer. Number 4 is non-therapeutic communication, reassuring the client the risks are minimal, so it's okay, don't worry about it. That's non-therapeutic communication. It's almost always wrong. Clients need safe and effective care environment, safety and infection control. There's 9 to 15% of the test questions are about this. Safe use of equipment, external and internal disaster planning, emergency response plan, ergonomic principles, preventing accidents, hazardous waste, prevention of infections and restraints. Here's a safety and infection control sample question. Physician orders ibuprofen 10 milligrams per kilogram by mouth every 8 hours for an 8-year-old girl. The nurse discovers that the girl does not have an identification bracelet while performing the 7 rites of medication administration. What should the nurse do? Ask the parents at the child's bedside to state the child's name? Well, they might be able to do that. Ask the child to say his first or last name? She might also be able to do that. Have a coworker identify the child before giving the medications. A coworker may be able to say, yes, I think that's who it is. Or hold the medication until an identification bracelet can be obtained. So if you are following safety and infection control, you are going to consider the fact that you don't know for sure unless all of the policies of the institution are followed, which always includes having an identification bracelet. So number 4, or the last answer, is the right answer. Client's needs, health promotion and maintenance. 6 to 12% of the questions are on this. Health promotion, maternity and newborn care, disease prevention, expected body image changes, family planning, family systems, growth and development, immunizations, principles of teaching and learning, lifestyle choices, self-care, physical assessment, data collection. Client needs sample question. A nurse is caring for a 16-year-old girl involved in a motor vehicle crash. The patient suffered second-degree burns on her face and hands. The nurse plans patient care knowing that the most likely primary concern of the teenager is body image, keeping up with schoolwork, obtaining adequate nutrition, obtaining adequate rest and sleep. If you're going to go, these are one of the exceptions to Maslow. So if you were going to go with Maslow, you would consider that obtaining adequate nutrition or obtaining adequate rest and sleep may be something that the person would consider. But the keywords is a 16-year-old girl and knowing the most likely primary concern of the teenager. It's body image. So any kind of thing that defaces their body, they're very concerned about. So the answer is A. Client needs. 3, psychosocial integrity. That's 6 to 12%, which includes substance abuse, abuse and neglect, behavioral interventions, chemical dependency, coping mechanisms, cultural diversity, end of life, support systems, stress management, therapeutic communication, and unexpected body image changes. Client needs 3, psychosocial integrity. We can go through some of these, stress management, support systems, therapeutic communication being the main ones. Client needs sample question. A boy is brought to the school nurse's office with reports of abdominal pain. On assessment, the nurse notes the presence of several bruises on the child's abdomen and back and several cigarette burn marks. The nurse suspects child abuse and plans for which priority action. So it already says the nurse suspects child abuse. What is the key word is, what's the priority action? Document the bruises noted on the child's body. Well, you would do that. It's not a priority. Call the parents to ask how the child's bruises and burn marks occurred. You could do that. It wouldn't be a very wise choice, and you probably wouldn't get an honest answer anyway. Notify Child Protective Services to facilitate the removal of the child from the abusive situation in order to prevent further injury. That is the priority action because you're looking for patient safety, client needs, and on the lowest level of Maslow is protection, safety, and security. The last answer, ask the child how long his parents have been abusing him, is a non-therapeutic communication, and like I said, it's almost always wrong. Client needs sample question. A 50-year-old male patient comes to the nurse's station, asks the nurse if he could go to the cafeteria to get something to eat. When told that his privileges do not include visiting the cafeteria, the patient becomes verbally abusive. Which of the following approaches by the nurse would be most effective? So we're looking for the keywords. Patient's verbally abusive. What approach is most effective? Telling the patient to lower his voice because he's disturbing the other patients? Well, that's true. Ask the patient what he wants from the cafeteria and have it delivered to his room. That is something you can do, but then you've added to the problem. You've added to the patient's want to do that again. Calmly but firmly escort the patient back to his room, or assign a nursing assistant to accompany the patient to the cafeteria. The only one that really is going towards therapeutic communication and really client's needs is calmly but firmly escort the patient back to his room. Physiological integrity, basic care and comfort, 6 to 12%. Complementary therapies, assistive devices, elimination, mobility, non-pharmacological comfort, so back rubs and things of that nature. Nutrition and oral hydration, palliative and comfort care, personal hygiene or rest and sleep. Here's a client needs sample question. A nurse has provided information to a client about a measure that will promote normal urination patterns and prevent urinary tract infections. Which statement by the client indicates a need for further information? So we're looking for the keywords. Which statement indicates further information? In other words, they don't understand. I should take my Lasix in the morning. I should drink plenty of fluids during the day. I should try to hold my urine as long as I can rather than expelling it when I feel the urge. Or I should eat foods that will make my urine acidic. So things that will promote urination pattern, normal urination patterns, and prevent urinary tract infections. So you're looking for two things. Taking the Lasix in the morning, well, that'll help, but it doesn't prevent infections. I should drink plenty of fluids during the day. Well, that's true. I should try to hold my urine as long as I can, rather than expelling it when I feel the urge. That's something that you would have to understand urinary tract infections. So it's asking you to understand the disease process and what the patient can do. So this one indicates a need for further information. And let's look at the last one. I should eat foods that will make my urine acidic. Well, that's true. So you know the answer is C, because this indicates that he does not understand. Physiological integrity, pharmacology. We're going to go through this in greater detail in the pharmacological session. Client needs sample question. Cyclosporine oral solution is prescribed for a patient who has a kidney transplant. The nurse provides information to the patient about the medication and tells the patient that which of the following is most important to monitor: temperature, peripheral pulses, platelet counts, or apical heart rate. This is asking you to both understand what the medication is for and know the side effects and its effect on the patient. You know, it's not temperature because that medication doesn't do that. Peripheral pulses are not affected by this medication. Platelet count or apical heart rate. Cinnamon does not affect the apical heart rate. If you understood the function of this medication, you would understand that it was platelet count that it affects. Physiological integrity, reduction of risk potential, that's 9 to 15% of the test. That includes diagnostic tests, laboratory values, monitoring constipation, potential for alterations in body systems, potential complications of diagnostic tests, treatments, or procedures, potential for complications for surgical procedures, system-specific assessments, therapeutic procedures, and vital signs. Here's another client's needs sample question. A 7-year-old girl with type 1 insulin-dependent diabetes has been homesick for several days and is brought to the ER by her parents. If the child is experiencing ketoacidosis, the nurse would expect to see which of the following lab results. So this is testing your ability to understand diabetes, testing your ability to understand that ketoacidosis could be caused by diabetes, and what lab results would you find with this condition. And so If you're looking at serum glucose is 140, that is something that you would probably not assume. Serum creatinine is 5.2. That is not something that you would expect. Kidney problems with this kind of condition, blood pH of 7.28. That is acidic. If you're looking for the lab results that show ketoacidosis, that's definitely one of them. Let's look at the last one. Hematocrit of 38%. Not really expected with ketoacidosis. So the only one you can really assume is the one that looks at acidosis or shows acidosis, and that's blood pH. So the answer to this one is C. Physiological integrity, physiological adaptation, 11 to 17%. Alteration of body systems, fluid electrolyte balances, hemodynamics, illness management, infectious diseases, medical emergencies, pathophysiology, radiation therapy, respiratory care, and unexpected responses to therapy. So, the thing about the test is they're rarely absolute words, so you can safely eliminate answers with absolute words. If a tentative word is used in an option, it is more likely to be the correct answer. Absolute words, I'm sure you understand these, but things that the way they might show up is always avoid foods with high fat content. Well, that may not always be true. Drink fluids only if they're sugar-free. Also, you can't always say that. Never take any of your medications on an empty stomach. So these are absolute words, and they're most often false. Examples of tentative words. Teenagers are usually concerned about the way they look. So that might not always be true, but it kind of suggests that's usually true. That's something that you might find. It is sometimes necessary to take your medication on an empty stomach. So this allows for you to use your critical thinking when you're looking at the medications. This medication may cause nausea. That makes you think about it. Oftentimes, patients go through grieving process after a family member's death. So this is something that you would want to evaluate as a key word, whether it's an absolute or a tentative. Laboratory values. You will need to memorize lab values of common blood tests. This is not something that you can avoid. And as I discussed earlier, this is all about repetition, repetition, repetition. This part is just straight memorization. You will need to understand what happens when a value is too high or too low. You will need to understand when a value is a critical value. Laboratory value sample question. Here's a sample question you might find on the test. A client with a diagnosis of sepsis is receiving antibiotics by the intravenous route. The nurse assesses for nephrotoxicity by closely monitoring which of the following laboratory values. Laboratory value sample test question. So it doesn't ask you to remember the exact value, it just asks you to think about which one, as you can see, is related to nephrotoxicity. That's the key word. Is it lipase, platelet, white blood cell count, or blood urea nitrogen? The only one that is related to your kidneys and that would cause nephrotoxicity is blood urea nitrogen. That's a test that is a measure of your kidney function. It doesn't ask you in this question to know what the critical values are. You only need to know what it is. And so this one is a little more simple question, but this is something that you might find. Look for keywords that will help you answer a question. Is an early effect of. It's the most important. What is the highest priority? As we went through the questions on this session, I always pointed out the keywords, what you're looking for. What is the highest priority? So that's there may be things that are all correct when that question comes up. What is the highest priority? But only one is the highest priority. What action would the nurse do initially? That means all of the answers on that question may be correct, but which one would the nurse do to start with? Keywords in STEM. Here, let's look at this sample question. A nurse is caring for a patient with a diagnosis of congestive heart failure who suddenly experiences severe dyspnea. The nurse suspects that pulmonary edema has developed. The immediate nursing action is, so the keyword, you're looking for severe shortness of breath, you're thinking about pulmonary edema, and you're thinking about what's the priority, what's the first thing, what's the immediate action. Place the client in high Fowler's position, sitting upright. Insert a Foley catheter, stat. Well, you might do that. but I don't know, you definitely wouldn't do that. Stat, obtain a dose of morphine sulfate from the narcotic medication drawer. You might do that, but that's not the priority. And begin oxygen at 2 liters per minute. Well, that's something you'd also might do, but we're looking for the immediate nursing action. So you sit the client up, helps them breathe better. That is the immediate. So all of these may be correct, but only A is the something that you can do immediately. Sample question, keywords in STEM. A nurse in the emergency department receives a call from the emergency medical services and told that several victims who survived a plane crash and are suffering from cold exposure will be transported to the hospital. The initial nursing action for the emergency department nurse is which of the following? So we're looking for the initial nursing action. So all of these may be correct. Call the laundry department and ask the department to send as many warm blankets as possible to the emergency room. Well, you might do that, but not initially. Call the intensive care unit to request that nurses be sent to the emergency room. You might do that also, but not initially. Call the nursing supervisor to activate the agency's disaster plan. So that is something that seems like it would be your immediate action. It would be your initial action. It would be something that you would do first. If it's related to following the agency's policy on doing the disaster plan, that's often the right answer, because they would never suggest, and in these test questions, that you not follow the agency's policies and procedures. And let's look at the last one. Supply the trauma rooms with bottles of sterile water and normal saline. You could probably do that as well, but you wouldn't do that initially. The only one that is correct on this one is C. Response options. You always eliminate the obviously wrong answers. We saw in the test questions and answers that some were obviously wrong, and you just can avoid those. They're just filler questions and filler answers. If two answers are opposites, chances are that one of them is correct. So if you see the answers and they're exact opposites, you can assume that, if the other two questions out of the 4 are not it, then one of those that are the opposites is correct. And long answers tend to be the correct answer because they don't normally write a fake answer or a wrong answer that is extremely long. Usually the long answers are the correct answers. And never pick the answer with non-therapeutic communication. So that is it for session 1. I encourage you to go on. Session 2 will be critical thinking.